The effects of the pandemic and the recession ripple across the country. Millions of Americans are struggling to stay safe and fed and in their homes, and the country's GDP is shrinking more than in any year since just after World War II. Just yesterday, House Speaker Nancy Pelosi said this about the path forward for a COVID relief bill.
We would hope that we would have bipartisan cooperation to meet the needs of the American people in terms of their health, in terms of distribution in an equitable way of the vaccine, continue with testing, tracing, treatment, et cetera, but also to meet their economic needs. So we would hope that, but we're not taking any tools off the table, should they not.
Garrett, what is the latest on that bill? How soon will Americans get the help that they need from Congress?
It's going to be a little while, and it's interesting. While the administration and even Speaker Pelosi are talking about the importance of bipartisanship, everything we're seeing lawmakers actually do on Capitol Hill suggests that Democrats are preparing to go it alone to try to pass this bill through the budget reconciliation process. That will take more time. They've got to pass a budget resolution. It's a much more technical thing to get something across the finish line. But when you look at what's in this $1.9 trillion bill, things like hundreds of billions of dollars for state and local governments, those expanded direct relief checks at $1,400 a pop, expanded unemployment benefits. Those were things that were probably never going to get the 10 Republican senators that Democrats would need had a President Trump proposed it. It's unlikely to be the case under a President Biden. So Democrats are still talking about bipartisanship here, but it's largely, I think, a warning to Republicans. You can be on this train when we pass this bill, or you can not be on this train. But Democrats seem committed to pushing ahead, even and especially increasingly likely doing so by themselves.
Weijia, what do we know about the White House stance on this? I mean, they've been asked about their willingness to break up that stimulus package, potentially into multiple bills to try to force things through. Do we know what they're willing to give on or cut or compromise on to get people the help they need?
Well, the White House has made very clear, and they've said on the record many times in many different ways, and from the president himself, that they are not interested in cutting this deal up and having a more narrow deal to address some of the more immediate needs, because they really feel that this entire package is needed for the long term to salvage this crippled economy. In fact, just today, President Biden was with his Treasury Secretary saying that the time to act is now, because there could be a real scar left on the economy if we don't invest this money and if we wait. And so they've made clear, as Garrett was just saying, that they want to pass this bill, and they don't really see that there's another option to wait any longer, to wait for some sort of, compromise to happen. But, this is challenging for President Trump. 4 years of covering one administration, for President Biden, of course, because, he has preached from day one the importance of unity, not only for the country, but for these two parties that could not be more divided. And, going at it alone for his very first piece of major legislation sets a tone about, what he is willing to do without Republicans. So, of course, their number one goal is to find the support they need, but it just doesn't look like it's going to get there.
Sarah, Kliff, briefly before we let you go, we've seen President Biden moving ahead unilaterally with things he can do alone, signing some new executive orders related to health care, specifically expanding access to the Affordable Care Act, particularly during a pandemic. What's the potential impact of that?
Yeah, so this will be a new open enrollment period on the healthcare.gov marketplaces. It'll run from February 15th to May 15th. It's essentially a do-over on the open enrollment period, which just closed in December. The Biden administration didn't like how the Trump administration ran it. There was no advertising. They feel people didn't know about it. So this will be a new chance for the Biden administration to tell Americans the marketplaces are open. You can shop for coverage. We know there's about 4 million people out there who could be eligible for no premium plans. They're trying to reach that population. We think the impact is going to be small, not giant, a modest number of signups from reopening the marketplaces. I think this goes back to our earlier conversation. You'd see a lot bigger impact if you could increase the subsidies to draw some more people in, make premiums even more affordable. That requires congressional action. It is part of the $2 trillion stimulus package we've been talking about. So that part is caught up in congressional negotiations. So really, this is what the Biden administration can do on their own to strengthen the Affordable Care Act. And it suggests, a posture from the Biden administration that they obviously care about this law. We know Joe Biden, how he's characterized Obamacare in the past. He thinks it's quite important. And he's essentially announcing it's still open for business and we are going to keep supporting it now that we're in the White House.